united in the fight for clean air and climate action to protect our children's health and future. The Inflation Reduction Act and the American Rescue Plan opened funding for air monitoring project selections, furthering the goal of President Biden's Justice 40 initiative. I'm happy to announce that the City of Detroit, Wildlife Habitat Council, the Green Door Initiative, Patagon Band of Potawatomi Indians, and the Asthma and Allergy Foundation of Michigan were awardees of these funds from the Environmental Protection Agency and the Biden administration for air monitoring projects. We are so lucky to have two of these grantees here with us today. On November 3rd, the EPA announced over $53 million for grant awardees to undertake air monitoring projects in 37 states, funded by the Inflation Reduction Act and the American Rescue Plan. These grant selections further the goals of President Biden's Justice 40 initiative, which directs that 40% of overall benefits of certain federal investments flow to overburdened communities that face disproportionately high and adverse health and environmental impacts. By enhancing air monitoring and encouraging partnerships with communities, EPA is investing in efforts to better protect people's health, particularly those in underserved communities. The Inflation Reduction Act of 2022 provides funding to the EPA to deploy, integrate, support, and maintain fence line air monitoring, screening air monitoring, national air toxic trend stations, and other air toxics and community monitoring. Joining me today, we have to discuss the importance of these air monitoring projects is Kathleen Slonager, the Executive Director of Asthma and Allergy Foundation of Michigan, Dr. Lyle Thompson, Director of Academic Center of Urban Studies at Wayne State University, and Keith Kiama, a Program Manager of the Air Quality Management Plan for the Green Door Initiative. Thank you all so much. Kathleen Slonager leads the Asthma and Allergy Foundation of America, Michigan chapter, a nonprofit charity dedicated to the education and training of all those affected by asthma and allergies, as well as the professionals that take care of them. Kathleen is a registered nurse, passionate patient advocate, and board certified asthma educator with expertise in asthma and allergy management and a complementary and alternative medicine. She is passionate about providing evidence-informed health information to aid consumers and clinicians in health and wellness. I'd also like to introduce Dr. Lyle Thompson, Director of Academic Center of Urban Studies at Wayne State University. Dr. Thompson is the Director of the Center of Urban Studies and a Professor of Political Science at Wayne State University. The center has a long-running program of studying impacts of pollutants on children and families in their homes in Detroit metropolitan area. The center has completed studies for indoor pollutants, including measurements of particulates, volatile organic compounds, lead, and molds. They have also studied the impact of interventions in helping children and families. Keith Kiama is the program manager of the Air Quality Management Plan for the Green Door Initiative. The Green Door Initiative aims to ensure that every person is environmentally literate, capable of practicing and promoting sustainability as a lifestyle. The Green Door Initiative envisions a world where everybody, irrespective of racial background, zip code, and income bracket, thrive in a healthy environment free of pollution, which impacts the air, water, and natural resources, and build the environment. Where environmental racism is a distant memory for generations to come, and environmental justice is a reality for all. I'd like to start today with a question for Dr. Thompson. Why is air monitoring so important? And what is your strategy for the installment of air monitoring systems?
So air monitoring is so important because already Detroit is an area where there is significant air quality problems. We are what is called an EPA non-attainment area. That is, we do not meet the national standards on ozone and sulfur dioxide. In addition, if you look at a map of particulates particularly PM 2.5, you find that there are high levels of particulates in many parts of Detroit. And that then leads to all sorts of problems with breathing. It can lead to diseases. It is a very significant problem. So that's why we want to monitor the air quality in the city, is to understand that properly. We have some monitors around the city, but if you go look at, for example, the purple air map of its monitors, 2/3 of the city is not covered by any of their air monitors. And most of the city and most of the monitors are concentrated in particular areas. Does that answer your question?
You're muted.
Yes, sir. And could you please explain what attainment and non-attainment means for our audience here?
So EPA has standards, and they say, above this level, you may not, you will be considered in non-attainment for sulfur dioxide, for example. Sulfur dioxide is produced, for example, by the power plants down along the river in the Detroit area. And that above a certain level, for sulfur dioxide for the whole area, for Wayne County, you're in violation of that standard. So you're in non-attainment. Whereas if you were below that standard, you'd be in attainment. And we are in a non-attainment status for sulfur dioxide and ozone in Wayne County, but the whole of southeastern Michigan is in non-attainment status on ozone, and probably would be on some others if they were consistently measured.
Thank you. And with that, Kathleen, what are the health impacts that ozone and some of these other pollutants are having on community?
Yeah, that's a great question. There are so many, and despite all the improvements in air quality over the last 20 years, poor air quality remains persistent in Detroit and Wayne County. And as a matter of fact, Detroit Wayne County got an F on the American Lung Association's State of the Air report in 2022. So we know that poor air quality and pollutants can affect neurological development, and this leads to lower cognitive outcomes. This means poor IQs. It also negatively affects mental and motor development and reduces attention span. Exposure to high-level air pollution may increase the risk for chronic diseases later in life. And we know that poor air quality and exposure to air pollution is a really significant risk factor for developing asthma, and is a big trigger for those who already have asthma. Air pollution increases wheezing and coughing, shortness of breath, worse COPD and asthma symptoms, increased rates of lung cancer and other cancers, susceptibility to infections, and premature death. But it also can cause heart attacks and strokes and metabolic disorders like diabetes, preterm births and low birth weight, and increased fetal and infant mortality. Poor outdoor air quality also contributes to indoor triggers, because about 60% of indoor air originates from outdoor sources. So indoor impacts on air quality can be made worse by the hazards like gas stoves and smoke generating activities, and of course, lack of air filtration. And a lot of the housing stock in Detroit is very old, and so some of these things are prevalent. And sadly, asthma is a real challenge in Michigan. Michigan is the 5th highest asthma rate in the country, well above the national average. And as a matter of fact, Detroit was named the #1 most challenging city to live if you have asthma in AFA's 2022 Asthma Capitals Report. And unfortunately, according to AFA's 2020 Asthma Disparities in America report, the burden of asthma in the US falls disproportionately on Black, Hispanic, American Indian, and Alaska Native peoples. These groups have disproportionately high rates of poor asthma outcomes, including hospitalizations and deaths. For example, Black individuals are 5 times more likely to be treated in an emergency room for asthma, and 3 times more likely to die from asthma than white individuals. And similar statistics are evidenced in the pollution realm. Exposure to air pollution is disproportionately experienced by Black and Hispanic populations, even though emissions are disproportionately caused by white populations. So you can see there's a lot of a myriad of health effects.
Yeah, those are concerning. So what is the state of Michigan's air quality in general? I know you had gone over some statistics there, but in general, are we finding a lot of cities that have failing air quality grades?
Right. So if you definitely want to look and see, what's your city rates, then do visit the American Lung Association State of the Air Report. You can put your zip code in and find out what grade. But as Dr. Thompson pointed out, Southeast Michigan is in non-attainment for so many items that, of course, this is affecting the air quality. But there's some other places folks can go to too to check out air quality, and it's pretty real time too, so it's getting better. But this grant is going to allow us to really enhance the collection of data. But some of the other places folks can go to is justair.co. Darren Riley is the executive director there, and he's been gathering a lot of good data on the different sensors taking measures in Detroit. And airnow.gov and purpleair.com are both real time. You can go and put your zip code in and gather what's going on in your area.
Yeah, thank you for that. Dr. Thompson, what will they do with the air monitoring data?
So, excuse me. We will be collecting data from each of the 31 zip codes in the city of Detroit. So we're trying to make sure that we have a network, a screen, as it were, of all the areas in the city of Detroit so that we can understand where air quality is the lowest, where it's the highest, and be able to portray that in an active way. What we will be doing with that air quality data is pushing it out there. And first, we will push out the air quality data that we capture from homes where we have people that will agree to do this. And for our outdoor air monitors, we're going to be using Purple Air, and that will put on the outside of a house, and then it will stream directly to the web to the Purple Air map. And that way you'll be able to see every area of Detroit instead of just about a third of the city, maybe a little bit more, that you see looking at that map now. In addition to that, we'll be monitoring indoor air quality using a different device that gives us a broader range of air quality measures, including particulates, nitrogen oxides, and volatile organic compounds. And that will let us see what's happening in the house, and that will allow us to help particular families and tell them, hey, you've got a very vastly increasing level of volatile organic compounds when you turn on your gas stove in the evening. We want to recommend some changes to you. And so we'll be gathering that. We won't put their internal air quality measures out on the web for everybody to see, because that would be unfair to them. But we'll keep that private, but we'll track it for them, and then we'll use that data and correlate it with the outdoor air quality to see how the outdoor air quality affects the indoor air quality, how closely they're correlated. Those are the things we plan to do with the data that we're going to be collecting.
And how, sir, do you see that data helping lessen pollution?
Well, I have to have a belief in the efficacy of our citizenry and their willingness to get out there and influence their public officials and get them to do things like turn off the sulfur dioxide producing power plants that are burning coal in the region. We need that kind of public support to move forward through projects like this Green Door Initiative to try to activate our citizens to work on that. The SiO2 the sulfur dioxide is just coming straight up along the river, right up into the east side where the Green Door Initiative is operating. We want them and other initiatives to get out there and encourage the public officials to do something about this. It's about time. We've waited dozens of years.
Yeah, that actually leads me to my next question. It's for Keith. Could you tell me a little bit more about the Green Door Initiative's program, air monitoring program?
Yeah, certainly, and thank you. So our monitoring program's main goal is to decrease asthma symptoms in children by reducing environmental asthma triggers found within childcare settings. And this will be accomplished by identifying asthma triggers in the environment, providing low and no cost recommendations to eliminate and reduce environmental asthma triggers, and also increase knowledge and awareness regarding management of environmental asthma triggers.
So why do you feel it's so important to engage Detroiters in the community about air quality advocacy and build a community knowledge at a local scale for air quality information in the 31 zip codes in Detroit?
It's important because, you know, Detroiters need to be part of the solution. For a long time, the people making recommendations have not really known what Detroiters want or need within those communities. And because our mission is to ensure that everyone is environmentally literate, capable of promoting and living a sustainable lifestyle, we feel like to accomplish that, we also need to work together. Because like the saying goes, teach a man, give a man a fish, versus teaching a man how to fish, right? And they won't be hungry anymore. So real-time air quality gives us the ability to prepare for the day and take precautions if necessary to mitigate these asthma triggers, for example.
And do you see these air quality issues as an environmental justice issue? And how do you see this relating to the Biden Justice 40 initiative?
Oh, definitely. They are an environmental justice issue. So air quality issues are environmental justice issue because they are prevalent in mostly disadvantaged communities that are marginalized, underserved, and overburdened by pollution. And that's why the Biden administration signed the executive order, which is known as Justice 40 initiative, to help these disadvantaged communities to be able to have a fighting chance in the future.
Thank you for that. And with that, I would like to just thank our speakers and open it up for questions. If anyone had any questions for any of our speakers today.
I just wanted to say one more thing quickly and to thank the EPA and the Biden administration for putting this funding out there. We're really proud to have received it along with the other groups and can't wait to get working on this and help make a difference in our community.
I see that Virginia has her hand up. Can we unmute?
Thank you. I'm sorry, I am puzzled by this because I feel like you said it, but can you hear me?
Yes.
I'm wondering, just for those of us who don't know about these funds, I'm still unclear what these funds specifically are doing and what the purpose is. In other words, I think that there's lots of information out about the presence of significant air pollutants, particularly in certain places around the country like Detroit. And even there's information about the sources, and I'm not quite sure what adding these, I mean, this is about the monitors that we're talking, that you're having the press conference today. I'm not sure what value added these additional monitors are and what the goal is to do with the information that they reveal. I know one goal is to somehow transfer this very scientific information to communities. But that, you know, I'm wondering if you could just expand on both those questions.
At least one of those questions I can help answer. I'm not going to have all the answers for you, Ms. Gordon. By setting up a network like this, one of the things we'll do is identify other places where there's low quality air in Detroit and the environs of Detroit, in the outer areas around Detroit. And I'm sure that will happen in other cities as well, so that we'll begin to be able to understand hotspots that have not been identified. And once you begin to identify, say there's someplace up in the northwest side of Detroit that has an intense hotspot, then we can get the regulators to come in and examine that at a greater depth and figure out what the consequences for the immediate neighborhood are, and perhaps ask that source to deal with the problems they're producing. So that's one of the key things. Another thing that, from a research vantage point, that we're very interested in is which of these outdoor air pollutants are getting into the house and exacerbating conditions in the house. We know that indoor air quality is a big problem for people, but we want to know the relationship between the outside and the inside as well. And we also have issues about the inside of the house and air pollution produced inside of the house and its consequences. For example, there's emerging information that cooking gases that are things that are off-gassed from the process of cooking can lead to illness, including cancer. There are some emerging studies on this. And if you, for example, don't have a vent hood, or if you use natural gas to cook, you may be exacerbating some of those situations. Another one is volatile organic compounds. There is emerging evidence that volatile organic compounds that come through the soil or through the air may be related to preterm birth in our country. And so we need to be examining these possibilities very carefully and understand that. So these monitors will help us, for example, to find out where hotspots for volatile organic compounds are in the community as well, that can either occur from the air outside, or they can occur from transmission through the soil, from old gas tanks and things like that. So there's a lot of opportunities to deal with health problems that are being identified through this process. I hope this helps you. Is this answering your questions?
Well, can I just summarize what I think you're saying, but I'm not sure, is that this will expand the level of air monitoring in the Detroit area? My follow-up question would be by how much? And if that expansion will reveal hotspots of various problems caused by air pollutants and then my question is, who will bring these conclusions to the attention of regulators, community organizations, and how will that be done? I'm just trying to figure out what this adds on to what's already going on in the world in terms of this type of research. And how it will be implemented. Does that make any sense?
Sure.
Okay.
I think it will help, one, inform people so they know what's going on outside their home or inside their home in our case. And so that if they have a high level of pollution in their neighborhood, they know to call their city councilman or their state legislator or their state senator and say, hey, can you look at this? Or maybe they even know somebody in Eagle and they can call them and say, because the information, largely speaking, will go out to the public through websites like Purple Air and other websites that are out there. So we're going to be informing the public about a lot of this information. I think that's one of the pathways that is going to be opened up by this. A second pathway is through very careful research that we and other participants in these grant projects will be doing to try to nail down some of the causes and consequences of what's happening with respect to things like asthma in this metropolitan area and elsewhere.
And does this represent like I'm trying to understand what's existed currently in terms of air monitoring and how this adds onto it? I'm trying to get a sense of context here.
Sure. There are a few air monitors that are maintained by the state and by the city that exist, the state and the EPA, I should say, that exist already in Detroit, but nothing like the expansion that we're talking about here. So a lot of areas are going to get attention where they've never been measured before, never been measured consistently. They might have a monitoring truck that drives through the area and then goes off. So that's a single instance. But in these cases, there's going to be continuous monitoring. So if somebody's off-gassing a bunch of very negative stuff at night, as was the tradition among a number of polluters, then we'll catch it through this process. And so there's a lot of opportunities for expanded understanding of the problem.
Thank you. I'll leave someone else a chance. I have a couple more if no one has any others.
Looks like there's a couple of questions that did come through. This question is from Allie. When do you start putting up the systems and where will they be?
I can go with that from our perspective, and then Keith could perhaps talk about his. We're still in the process of contracting with Asthma and Allergy Foundation, and she's still in the process of waiting for EPA to set up the formal grant infrastructure. But let's assume it's 2 to 3 months down the road and all that's underway, then we'll be going to individual households and asking them for permission to install the air monitors in their houses starting late winter, early spring. And we'll work at that until we have all 31 installed. And then we've maintained a set of monitors that we can, that are backups. And so if any of those break down, we'll go back to the house and set up new ones. And so later this year, we'll be populating the map, I would think.
And for GDI, Green Door Initiative, we will be setting up monitors, outdoor monitors at childcare facilities specifically. We've done some of those already in partnership with Just Air and the Ecology Center. So that's already in the works. But just to backtrack and go back to the earlier question, I was just gonna give a smaller scale example. For example, by what we're doing, part of what our goal at GDI is to, mitigate the asthma triggers. So if a parent has a child at a particular childcare facility and they notice that, once after spending the day there, they come back and they're wheezing much more than they would be if they were at home. But us visiting that facility, providing recommendation after doing an assessment, hopefully they'll be able to mitigate those asthma triggers in those childcare settings, and then hopefully that would translate in those kids suffering from asthma not having those as asthma triggers. And at the end of the day, we'll be lowering the ED visits and healthcare costs.
And the second part to Allie's question asks, does having this data help inform the future EPA rulemaking, for example, soot, methane, et cetera?
I think the simple answer to that one is we can't know for sure because they view monitoring data using consumer level monitors or these kinds of monitors that are being set up to be a different animal, which they may or may not be able to use in their regulatory processes. So I think that's to be answered.
But definitely it'll inform their decisions.
Yes, and I think it will allow us to take a position with data in hand regarding those things.
Yeah, like you had said before, these monitors are going in areas that haven't been monitored before. So you're going to be getting information throughout the entire city as opposed to just certain targeted areas. So you'll be able to track these pollutants in a more concise way. And then also, in addition to informing the public then will also be able to advocate for themselves, knowing what is going on in their communities. So when we do have an opportunity to meet with our representatives from the Environmental Protection Agency, we are now informed citizens to be able to address these issues in a more specific way as to who's causing the harm in the area and what protections the community needs to help with health issues, both short-term and long-term.
Without getting specific, but putting on my political scientist hat, there's been a dramatic change in the composition of Michigan state government in the last 30 days. So there's a lot more opportunity going forward to have an impact with the state legislature than there has been since literally 1983. That was the last time we had a unified presence among people that might advocate for this in Lansing.
Keith, is this the first time that air monitors have been put into preschools and daycare centers?
Not from GDI's, from GDI, yes, but other organizations have also been doing it, but
Well,
on
I'm
a small
sure,
scale.
right, with kids, still developing heart, brain, and lungs, that is information that I'm sure the EPA would be interested in gathering, and I'm glad you're doing that. Are there any more questions, Tina?
Not that have come through on my chat. So I think that might be it.
Once again, I'd like to thank the press for showing up today, for our speakers for joining us and educating the public. And if there isn't any more questions, then we will just wrap this up.
Thank you all for involving us and giving us an opportunity to explain our new projects.
Absolutely. And thank you once again for everyone joining us today. If you have any follow-up questions, you may email Mom's Clean Air Force and we will get back to you. Thank you so much.
Thank you.
Thank you, everybody.
Thanks for joining us.
Thank you.
Bye-bye. Danielle, you want to hang on?